New York, New York, please vagabond. Hello, I am Ashley Kikana. I am an analyst at the New York State Department of Public Health. I am going to identify the top performing hospitals for New York and compare them to national data. The primary measures that are going to be used are an analysis of the hospital discharge cost, readmission rate, and the case mix index. The tools for this analysis used are MX Excel and Access. The source of data comes from the CMS 2018 data for state and national hospital performance. Here we have the five top national DRGs by discharge. Top 5 New York DRGs by discharge. Here we have a pie chart with New York's 5 top DRGs. An analysis of the top discharge DRGs, New York versus top national. Here we have a column chart comparison. Analysis of top costs per discharge DRGs, New York versus top national. Top discharge DRGs are the categories of medical conditions or procedures that result in the highest number of patient discharge from hospitals. They highlight the areas with the greatest volume of care utilization. DRGs are ranked by volume of discharge, making them the most common nationally and in New York, not necessarily the most expensive. In New York, the five top DRGs volume by percentage from the pie chart, septicemia has 37%, major hip and knee replacement at 24%, heart failure and shock 20%, septicemia without MCC is at 10%, gastrointestinal disorders at 9%. So which DRGs are less costly in New York? None of them. They are all expensive. They are higher than the national. So septicemia is actually 13% higher in New York than national. Hip and knee replacement is 4% higher in New York than national. Heart failure is 24% higher in New York than national. And septicemia without MCC is 17% higher in New York than the national. So, which DRGs are most common and costly in New York? All DRGs are very expensive in New York, and the national average is the heart failure with 24% cost increase in New York compared to the national top DRGs. The four that are in common are 871, 470, 291, and 872. But DRG 392 is unique to New York for pneumonia, and DRG 193 appears to be in the top 5, but not for New York. Top 5 national DRGs cost by per discharge. Here we have a cost per discharge column chart. Top 5 New York DRGs cost per discharge. Here we have a column chart with a cost per discharge of New York. Analysis of the top cost discharge DRGs, New York versus top national. The top cost per discharge DRG reflects the most expensive hospital cases per patient discharge. Most are not frequent. They identify high cost treatments that significantly impact healthcare spending at the state and national level. DRGs are the most expensive but not the most common. While discharge counts are low, the per patient costs are incredibly high, which indicates that there is a high resource use or a complex procedures that are being done. Column charts are effective for visualizing the differences of cost per discharge, allowing a quick comparison between DRGs that highlights the large gaps in spending. Top cost DRGs that are in common between New York and the national, the ECMO or the tracheostomy, and it is more costly in New York. A lung transplant that is more costly in New York. A heart transplant with MCC, and it is more costly in New York. DRGs are more costly in New York than the national heart transplant, lung transplant, and the tracheostomy. Top five hospital by discharge for New York, cost per discharge, and the readmission rate. Here we have a combo chart. Top five hospitals by discharge for New York, cost per discharge, and the case mix index. Here we have another combo chart. Top five hospitals by discharge for New York, hospital volume and cost analysis. The highest discharge was New York Presbyterian Hospital with 25,805 discharges. The most expensive was NYU Langone Hospital with $140,966 per discharge. The least expensive was Long Island Jewish Medical Center. They spent $81,793 per discharge. The readmission rate reflects the percentage of patients readmitted to a hospital within 30 days of discharge. It is a key quality indicator that the high rates often reflect complications or an inadequate post discharge by CMS 2023. NYU Langone Hospital has the lowest readmission rate of 15.5%. Montefiore Medical Center has the highest readmission rates with 17.3%, and the statewide average is 16.2. New York Presbyterian Hospital is actually below the state average at 15.4, which indicates that they have a better than average care coordination with post care discharge. Case Mix Index measures the clinical complexity and resource intensity of patients being treated. A higher CMI indicates that more complex cases require higher resource use. Zuckerman 2011. The lowest CMI comes from Long Island Jewish Medical Center with a 1.5, which reflects a low complex patient population that aligns with the lower cost of their discharge at $81,793. The highest CMI does come from New York Presbyterian Hospital at a 2.2, but they do treat higher complex cases, which is comes with an association to higher cost at $123,261. The most favorable CMI with cost comparison comes from New York Presbyterian Hospital. Although their CMI is pretty high at a 2.2, they do have a moderate cost at $123,261, which is an indication that they do have an efficient management of their complex cases. The least favorable CMI with the cost comparison does come from NYU Langone Hospital. They have high cost per discharge of $140,966, but their CMI is at a 2.1. That indicates that they have a higher than expected cost for case complexity. Top 5 DRGs for New York Presbyterian Hospital. Top 5 discharge DRGs for New York Presbyterian Hospital compared to the entire state of New York. Top 5 DRGs for New York Presbyterian Hospital compared to the entire state of New York. So, what is in common between NYP Hospital and the state of New York? Well, they do share septicemia, heart failure and shock, major hip and knee replacement, and GI disorders. But none of the DRGs are less expensive, but all common DRGs are more expensive at NYP than the state average. So, which DRGs are more expensive at NYP? We have DRG 871, DRG 291, DRG 470, DRG 392. So 93% more expensive, 57% more expensive, 17% more expensive, and 32% more expensive. What's not in common though is that there is a DRG 690, kidney, urinary, and tract infections. They are in the top 5 for New York Presbyterian Hospital, but they are not in the top 5 for New York itself. That is because New York Presbyterian Hospital is a major territory and an academic referral center that receives complex and transferred cases, especially in nephrology and urology specialties. They do have a presence of a high-performing kidney care program that includes transplants and dialysis services. The New York Presbyterian Hospital is affiliated with Cornell Medicine, Columbia University, and serves a large, diverse population across Manhattan and the Bronx. It is a center for kidney disease and transplantation and is nationally ranked, and it attracts a high volume of urinary tract related admissions. New York Presbyterian 2024. In conclusion, the most common DRGs for New York and New York Presbyterian Hospital include septicemia, heart failure, joint replacement, and it just indicates that they have a similar demand in acute and chronic care services. At the New York Presbyterian Hospital, they do treat clinically complex patients, which reflects in their case mix index 2.2, and they do have a higher readmission rate in some of the areas. The readmission rates across the hospitals like Montefiore that do exceed the state benchmarks is an area for improvement where we can improve their care coordination. I do recommend that we improve the care transition and the post discharge planning in order for us to reduce readmission rates at the hospital like Montefiore by strengthening up their follow up care and patient education. By developing a multidisciplinary transitional care team and establishing an automated post discharge follow up system that will improve the continuity of care. So, we need to address and reduce New York Presbyterian's high cost DRG. Conducting the internal reviews will assess whether the high costs are aligned with the outcomes and the resource utilization. Performing a DRG specific utilization review, we can compare with peer institutions and identify the cost drivers in the clinical workflows. Lastly, we want to leverage the specialty strength strategically. At the New York Presbyterian Hospital, they should continue to invest in high performing specialty programs like their kidney transplant program while exploring their efficiency models to optimize the cost without compromising any of the quality. By maintaining their specialty leadership in kidney and transplant care and implementing a value based care pathway that will improve the outcomes and reduce the variation in the cost. Thank you. And these are the references that I used for this analysis.